Good morning, Miss Christine. Hi, Miss Valerie.
Hey, Buffy.
Hey.
Morning.
Oh, get my chair right here. Oh boy, y'all doing all right today?
Yeah.
You're wonderful.
Good, good. Well, we got 1 minute, so I'll give them that minute to see if anybody else is going to sit down with us this morning when we have our health secrets for seniors.
So is Buffy your middle name or a nickname?
It's
or
a
just,
nickname. I've had it since I was in the probably about 8th or 9th grade, maybe before that. It was
Wow.
it was a television show used to come on called Family Affair back in the
Oh yeah.
60s,
Uh-huh.
and the daddy on there, the uncle, his name was Bill, and my father, they called him Bill. My next door neighbor's name was Jody, the little
Okay.
brother. My next door neighbor's name was Jody. And then
Jody,
at the time, I used to wear these bangs just like the little girl all the way across there,
Right.
that roll all the
Love
way
it.
across there. And they just started calling me that. And I
I
just
very,
kept it.
I very much remember that show. And Mrs. Beasley,
Yes,
the
yes.
doll.
Good morning, Miss Lily. How are you? Good morning, Miss Lily. Can you unmute?
There we go. Hi, good morning.
How are you?
I'm fine. I actually had to get dressed today because I had an early morning appointment, so I get to see you.
Well, you look fine and fabulous right now. You look fabulous.
Thank you.
Well, good morning. Hi, Miss Betty, Miss Ruth, everybody that's tuning in. Good morning. It's time for our health secrets for seniors. I'm always trying to come up with a topic, something that we can talk about, something we can sink our teeth in and have a conversation about. Health is not only physical health, emotional, mental, it's just all kinds of things that make us human, that keeps us healthy. And my greatest concern right now behind the COVID is our mental health. I just worry about it. I think I said this the other day that when I'm not seeing my folks when I was at Darnell every day, if I didn't see somebody regularly, somebody might come up to me and say, Miss Buffy, have you seen Mary Baldwin? And I would say, well, no, I haven't seen her. Let me go call and check on her because I had so many classes with 50 or more people in it. Sometimes you would forget. So I would always try to make it a point to check up on my folks. Even now, people are still calling the center. There are people who still don't realize that the centers are closed. So I check my voicemail in my office on a regular basis because the number that's on the internet, if you look up Darnell, they got my office number on there instead of the main number. I don't know why. It's been like that forever. So I get a lot of calls into my office that's not even related to fitness. But usually if it's something that's not related to fitness, I try to help them, whoever it is, to get to whatever person they need to talk to. So we've been talking about our health care tips, and I've got a list of things that we want to try to make sure that we do for lasting wellness beyond COVID. You know, before COVID came about, a lot of you, I saw you on the regular in my classes, and I tried to encourage people to not let age be a detractor from having a good time. That was one of my greatest pride and joy is the Darnell Divas, which is the dance team that I helped establish. And I always said it wasn't me, it was the seniors who became members of the dance team. We surprised so many people that had this image of seniors being little old ladies was sitting there with making some cookies or something. And that is so far, far from true. And now that I am a grandmother myself, I am not the cookie making grandma. You know, I said this before, I'm the grandma, you have to tell me where to go buy it, let me order it, and I'll go pick it up. I'm not the grandma can sit there and bake cookies and make them look all cute and everything. That's why they got the bakery department at Publix for folks that like me. So we're going to talk today about the things that we want to do on the regular so that we can try to have long lasting wellness. Nobody's going to live forever. We know that. But what we do want to try to do is age as well and as gracefully as we possibly can. One of the things that we used to do at the Darnell Center, I think they also had the same thing at Bowden, was that we did a fashion show every year. And we could seat 300. We would sell out that show every year because people would just come to see the seniors. And I loved it because it put the seniors in a different light, that people get rid of that stereotype image of what they think a senior citizen is supposed to look like or supposed to do. You know, when they would come out and nail a routine, I have so much pride. I would be like a mother. You know, my chest would be about, my heart be about to jump out of my chest because I would be so proud of their accomplishment. And then I could look at the audience and see people's, I could see their mind changing. Wow, I didn't think my grandmama could do that. I didn't know my auntie even had thoughts like that. You know, it just brings you so much joy to educate others about, if you live long enough, you're going to be walking in these same shoes. If you're blessed to live long enough, you're going to be walking in those same shoes. But what my goal is for us to walk in those shoes and tall and healthy for as long as we can. So one thing that we all need to do, and I'm sure that pretty much, at least I hope everybody that's tuning in today, you got to be insured. Got to have that insurance. Got to have that insurance. So you want to try to have a comfortable, healthy life while growing old, you got to have some health insurance. You know, whether you had a job that provided insurance on your job, or whether you took the time out to get some insurance on your own. I didn't realize until I became a caregiver. And then when I was trying to ask my mom about different things, when I started handling her business, which took me like not tooth and nail to get to that, was that she couldn't remember if she had any insurance, life insurance. You know, she couldn't find, she didn't remember what her supplemental insurance was. So I had to research, and I mean, I had to, you know, dig deep to try to find, because I didn't know, because I never handled her business. So I'm not saying you got to let your children know all your business, or whoever you consider your next of kin or whatever, but you do need to let them know some things so that they won't be floundering around in the dark if the time comes and you need it. Because I was so glad that I went on and started trying to find out when she finally said, well, you know, she started allowing me to handle some of her business, because I didn't know where anything was. I didn't know anything. And it was, I had to call where she used to work, because she taught school for 30 years. I had to get power of attorney, you know, in order for them to even give me information.
Yes.
So if you know that you got all your stuff, you still need to let somebody know where it is and what you got. Now, that's not saying tell them that, you know, I got $100,000 over here in the corner in a box under the bed. But if you know that you got your life insurance covered, or you've got your health insurance, and you get sick and unable to speak for yourself, you need to be able to let somebody should know, at least the basics, so that they can help you, so that you won't be laying there and then whoever your family members are tearing their hair out because they don't know where Big Mama got this or Big Mama got that, or Big Mama, God forbid, pass on, then the family around there trying to figure out, do we have enough to bury Mama? You know, if you got a policy, let somebody know. I remember I told you all that before when we talked about the National Emergency Preparedness. Put all your stuff together. You know, like if you have to go to the hospital in an emergency, if you still have presence of mind, get the bag, or tell your whoever it is that if something should happen to me, God forbid, but if it does and I'm unable to speak, here's where I keep the emergency stuff, so they'll know what to do. Because when it's an emergency, people sometimes tend to panic. I have found that I don't panic when it's somebody that's not a family member, but I'm not so sure how I'm going to react when it is my family member. I'm good, because at Darnell, we had people get sick all the time dealing with Miss Christine.
We sure did.
And we moved quick. You know, staff, we had a protocol to follow, and we moved quick. because there's no room when you're dealing with an older population to say, well, go on over there, like you might tell a child, just go over there and sit down, put your head down, you'll feel better in a minute. You can't do that. So we want to make sure that you got health insurance. And you know that as you get older, it's hard to get insured.
Yes.
You know, when you get up around 80, because I, you know, the research department, I was doing some research. It's hard to get insurance after a certain age. So you want to make sure that if you don't have anything now, start looking into that. Okay. That's the number one thing. Okay. Then the next thing, we want to clean up our diet. We talk about this. I talk about this so much because I'm in the health and fitness thing, but nutrition and exercise go hand in hand. And a clean diet is fresh fruits and vegetables, corn flour, other similar items that are rich in fiber and protein, and vitamins should be prioritized over processed food. You know, stay away from your bolognas, you know, lunch meat, sausages, those types of foods have a lot of processing in, which means there's a lot of man-made stuff put in them to preserve them. So you want to stay away from that. And this will help keep your body clean and also help you keep away from disease. You eat clean, that's going to help your body to be clean. Anybody want to chime in at this point? Y'all just let me do all the talking. Y'all know I can talk all day now.
We love to listen to you talking, Buffy.
It's hard to get away from the processed foods. You were just talking about like the lunch meat and the sausage and stuff. But I do turkey sausage. So if that's any better. But,
well,
yeah.
I don't think from what I understand from the research department, it's not so much whether it's turkey or pork, it's the processing and the part that man puts in there. You know, the all that stuff that they use to preserve it.
Yeah,
and
the
sausage
sodium
has a lot of
nitrates and the nitrites and all of that stuff.
Exactly. So I don't think turkey bacon or regular pork bacon, you know, either one of those products is going to have a lot of stuff in it. Even if it's turkey, it's still going to be a lot of things, man-made items, nitrates, citrates, all them eights are going to be put into those foods. So you want to try to stay away from that. It's really better if you can to have fresh meat. Like if you're going to have turkey, it needs to be, you know, turkey that you just cooked. You can buy the low sodium at the deli. You can buy like low sodium chicken or low sodium turkey, you know, where they haven't added a whole lot of extra stuff to the meat if you're going to be doing the deli. But now if you just go in there and buy a Hormel 8-pack with all the different salamis and all that on there, that's not clean eating. If you're eating fresh fish, if your doctor allows you to have seafood that's fresh, you know, but living in Atlanta, there are only a few places where you can get like fresh seafood because we're not really near the coast. We're inland, so anything we get seafood's got to be trucked in, flown in, brought in. So you want to take that into consideration as well, okay? All right, we've talked about this before. Get enough sleep. Sleep is one of the most crucial sources of energy for human beings. And you want to get good sleep. You want to not stop taking all those naps during the day. That's not the good sleep. The good sleep is setting a regular bedtime, having your bed area, your bedroom, accommodating for sleep and rest, and doing it at the same, you know, try to have a set schedule, but power napping during the day. Well, I'm gonna take me a nap right now when Buffy get through talking. I think I'll go over here and sit in front of this TV and catch me a little nappy bappy. No, don't do that, okay? You wanna get some regular goods. And remember, we talked about sleep, that you need at least 7 to 8 hours of sleep. Even if you're elderly, you still need that good nighttime, uninterrupted sleep, okay? Knock out all those power naps. When you were working a regular job from 9 to 5 or from 8 to 4, when did you take a nap?
You didn't take one.
You didn't, right. You see, that's what I'm saying. You worked all day and probably went to the grocery store and the mall after work, picked your children up, did all of that, and you didn't get a nap, but you went to bed at night and slept even if it wasn't but 6 hours, you slept those hours consistently. So that's what we want to try to adhere to, that good sleep. Number 4, the next thing is to, and we talked about this too, is prioritize your mental health. With this COVID virus and the social isolation, excuse me, our mental health is under attack. For those of you that believe in God, the devil is busy. You know, if you believe in God, I mean, you know, I'm not preaching. I'm just saying that it's just busy right now. Being able to keep our minds clear, our hearts and thoughts clear. That's a job right now because we are at home and we don't have as many things to keep us busy, which is why we talked about having plans, you know, making plans. Even if you're not going outside of your house, make a plan for your day in the house. Write your plans down. You know, I'm going to redo the books on my bookshelf today. I don't like the way they look. I'm going to do that today. Things, you got to keep that mind clear and keep that spirit clear. You don't want to not let your mental health be number one. You know, and I could be wrong about this, but I just believe that if you got your mind, if your mind is still intact, you can defeat a lot of things. You know, because if your mind is clear and you got a health issue, your mind is going to help you to fight that health issue. But if your mind goes south, then you don't even have that to help you battle anything with. So that's why I encourage us to have mental health. And it's easy to get anxiety ridden, and it's difficult as we age, that we're fighting the things that cause us anxiety. I mean, not just COVID, and even on top of the COVID, we have issues that are germane to elderly people like ourselves, people who are old, getting on up there, worrying about our health. If you don't have insurance, we may be worrying about that. If you're not eating and you don't have the money because you only got your SSI, that's another set of anxieties. But then we got to know how to get rid of those anxieties. And we talked about this Tuesday about not having pride be your guide. Be willing to ask for help if you need it. Seniors, a lot of times we are so prideful, because I am guilty of it as well, prideful about asking for help. You know, so we want to get away from that. A busy mind doesn't have too much to think about or worry about. So if we keep our minds busy, if we use, I'm just all over this planner thing. That made so much sense to me when I was doing my research with the research department, that writing it down, because I'm a big writer down of things. You know, I have to write it down, because if I don't, at this point, it's gone. Yeah. And I'd be lucky if I can remember where I wrote it, but you want to write it down. Keep that mind going. You know, if you're going to do Bible study, or you got a book club, like I said, I know that Darnell, our social worker, Erica, is starting a book club. It may have already started. I don't know, but I know that that's coming up. Oh, it's already started?
Yes.
Good. So maybe you weren't a person that liked to read books back in the day. Well, this is a very good time to try it out and see, maybe you might find an interest in reading books. All my life, I was a reader because I was the only child. And that was all I had to do, because I didn't have anybody to play checkers with. I don't know how to play two people games that much now, because I didn't have anybody to play with. You know, I grew up with my grandmother, my great-grandmother, my mama. So those games that required you to have like a sister or a brother there to play with you, like checkers and stuff like that, I never learned how to play those games. I still don't know how to play them. This might be a good time for me to learn how to do that. I just thought about that. But there are so many things that we can do, even in spite of this, to keep our minds busy.
You know, something else?
Yes.
I've always been a list maker, and it used to drive my kids crazy, but now they're starting to do it too, because they keep forgetting things. But as I do things, I check them off also, and it gives you a sense of accomplishment. Exactly. So you can say, what have I done today? Well, you can look at your list and you can see exactly what you've accomplished. And that also sort of lifts your feelings, your emotions a little bit.
That is so true, Miss Lily. I'm a list maker myself. I will when I was in the office at the center, I would write down things to do today. I try to list everything that I needed to make sure that I got to it that day. And as I completed the task, I put a check mark by it. That's done. This is done. Particularly if we were having a big event that fell under my umbrella, like with the Divas had their recital. You know, I had my list of, okay, we got to get the banner. I got to get the balloons. We got to do this. We got to do that. And as we accomplished everything, I checked it off to make sure that when we had our meeting to see where we were on top of everything.
Right.
That's so true. The next thing, which we all, now I won't say all of us, but I'm encouraging everybody, keep your muscles active. Inactivity, just sitting around, or the lack of activity in old age can result in irreversible damage to the mobile system of your human body. If you just sit, what do you think is going to happen to your muscles if you just sit?
It hurts when you get up. You try to get up, you're like, oh. That's why I love stretch. That's why I love stretch and tone, Meletta. Thank you so much. I enjoy stretch and tone.
You have to use that body. I tell the seniors, my students all the time, that if you don't use it, you will lose it. Even if you got, as they say, Arthur, cousin Arthur. The Arthritis Foundation says that you are to try to move those muscles in spite of the pain. And I'm not saying that you're supposed to do it till, you know, oh my God, it hurt. But that little pain, if you don't use those joints and muscles, eventually they atrophy to the point where you don't have anything left. You got to work through that. When you see me exercising, don't think I don't hurt too. I'm 68 years old. So yeah, I have aches and pains like everybody else, but I also try to push through it because I know that inactivity is, you know, if you start today, it's just like I tell the people that come to Stretch and Tone. I do a variety of activities in the class because I was kind of, you know, even as like you guys were used to a certain thing, I had 2 classes. So I had my advanced people where we just went to work. You know, we that was the class designed for you to sweat. You know, that wasn't for the faint of heart. That was for the folks that could keep up. And then we had our other class, which is okay if you can't keep up that fast, but we got a class for you too. So now, because I've got all kinds of different, I'm adding little bits. I threw my little Zumba back in there the other day. People were like, what is she doing? Because we can do this. I know this. So I'm trying to make sure that every time somebody comes to class, you're able to do something and do it well. You might not be able to do that, but you may be able to do this and do it well. So that's why I do a hodgepodge of the exercises more so now in both classes because I got different people and I don't know everybody. Whereas at Darnell, I saw people, and when people would register for class, sometimes I would just walk up to them and tell them, you know what, you've been in my stretch and tone class too long. You need to go, you need to move up because you're not challenging yourself.
And especially speaking as a new person to your class, it's a challenge each day, and I kind of have a little joke going myself. Okay, what's she gonna do new today? And when you do it, for me, I don't know if it's new to other people, but you'll do a different move to what you did the other. And I said, that's the new thing. Okay, this is our new move. And when you did that the other day, I was like, that was new to me. That shimmy thing. I said, okay, that's our new move today. And it's a joy. It really is. I like the way
that's
you change
the whole
it up.
point.
You do the same thing, but then you change it up. You throw something else in there. I say, yeah, that's it.
Yeah, and I've been, you know, as we started this fitness program on Zoom, I was, you know, I had to do 2 classes, but I was trying to make sure that I, you know, when working at Darnell, we were always so busy. I never had opportunity to go to any other center just to visit, to see, or anything. All I had to concentrate on what was going on at Darnell because we had a lot of people, big classes of 50 or more people in our exercise class, in the line dance class, you know, things that the seniors enjoy. So now I'm trying to add little bits of, because we used to do a lot of dancing in our advanced class to the point we would be ringing. I know I would be ringing wet. How about you, Miss Christine?
Same here.
So I'm trying to bring everybody back up slowly because we got different people in there, but we want to keep those muscles active. Even if you're sitting in the chair at home, After you sat an hour, every hour you need to get up and move around for at least 15 minutes. Don't just stay there in that chair in front of that TV all day, only getting up to get you a snack.
Buffy,
Yes.
this is what keeps me going.
Okay, is that your Fitbit watch?
Yes, it
Okay.
reminds me every hour that I need to do 250 steps. And it
Okay.
lets me know 10 minutes before the hour how many steps I need to go in order to get to my 250 steps.
Right. We need
And
to
I can't
How do
get
you
too
10,000 a
comfortable.
week.
How do you do those steps in the house, Christine? I'm just curious.
I just walk around the house.
Really? Just walk around.
Yeah.
You can
Yeah.
do
I
200
walk
steps?
around the house, walk back and forth, just walk around the house until it taps me on my wrist to let me know that I have completed my 250 steps.
And we like for you to try to do at least 10,000 steps a week. It
I-
sounds like
A day.
a day.
I've
Thank you.
only obtained that goal a couple of times at 10,000 steps a day, but usually I average out about 8,000 a day.
Right. So that's the goal. So please don't just sit and vegetate in front of the screen. Like when we get through with this class, which this time just really flies. When we get through with this class, it will be 30 minutes. So you want to try to get up and you can walk around I was trying to get my mama to walk around through the kitchen and back to the living room, through the kitchen, back to the living room. Just to get that exercise up and going. Number 6, I'm gonna have to rush on this time. I told y'all I love to talk. Okay. Go for regular checkups to your doctor, even if you're doing the telepathic, I'm not telepathic, the
Conference. Teleconference, huh?
the teleconference with your doctor.
Oh, Lord.
Still do that on the regular basis so he can look at you. Because sometimes they might just see something just by looking at your eyes, or am I right, Miss Christine, from medical
You're
point?
right, absolutely.
So you still want to make sure you're taking in, using those regular checkups, even if you cannot go into the doctor's office, still do those conferences with your physician so he can look at you and see you, hold your arm up. I got this knot right here, so he can at least look at it and see. Okay. And then the last thing, stay in touch with friends and loved ones. Moral support at this time is key, that we support each other. Even them folk you've been mad with 10 years, call them. You probably don't even remember why you were mad with them in the first place. They probably don't remember either. This is a good time to reach out and touch by phone, by Duo, by Skype, by FaceTime. There's a way for you to reach out and communicate with somebody. And use this time as it's a good time to reconcile. If you got any leftover bad feelings, let it go. And let that person know, I love you. You don't have to see them every day. I have friends that I might not care for their friends, but I always was nice to their friends whenever I was at their house, because I said, I'm not going to be over here every time that this person is here. And for an hour, I can tolerate this obnoxious person. I can do that with a smile. They'll never know. And then I just let it go. But this is a perfect time to make sure that you are talking to your loved ones. Call that niece that you haven't talked to in a long time, or if your sisters or your brothers, cousins, or all those folks, friends from the center. You'd be surprised at the number of people at the various senior centers that live by themselves and don't have nobody. You will be surprised at that. And I was surprised because we've had to make wellness calls, and I get on the phone and, y'all know I can talk. So talking to them, find out not trying to get in their business, just find out that they don't have anybody to talk to. And just make it like a ministry to make sure that you call somebody. I'm encouraging all my people in my class, the people that I see all the time, to reach out and touch somebody via phone, Skype, Duo, whatever it is, whatever manner you use, or regular old telephone. Call somebody, and it just pays. What'd you say, Mr. Gurley?
I said, I heard that. Call somebody.
Call somebody. You never know, somebody, you don't know, you might be the only person they talk to that day. You know, you might be the only person that says, well, I'm gonna call Miss Valerie. We used to work together 10 years ago. I'm gonna call her and see how she's doing. Or that might be the only person calls that day. We just don't know. So those were the 7 tips that I wanted to talk about. These things that help us to have lasting wellness. And the last thing I'm gonna do, I'm running a little bit over time. I got 2 minutes left. This was something I used to do in all my fitness classes. I encouraged my people to know each other by name. And then I would name everybody. I'd go around the room and I'd name everybody. Then I would say, Miss Lily, I want you to name everybody in the class. So now as I'm looking at everybody in Zoom, y'all names show up on the thing. Am I right?
Right.
So I'm gonna say, Miss Lily, so good to see you. I know Miss Christine. Miss Christine is one of my divas. And she's also one of my nurses on our ER team at Darnell. I always told her, if I get sick up here at this center, y'all go get me. Miss Betty Coleman. Miss Ruth, are you asleep over there? Miss Ruth, I see you over there, Miss Ruth.
Oh, she is right there. I thought she had
Yeah,
left
she
the
right
room.
there in that chair.
I see her.
Mr. Gurley, good to see
Hey.
you. Janice Culpepper, you're not showing your face, but when you get a chance, let us see you and you can unmute yourself. Miss Janice Culpepper.
I got an
Yes,
11
ma'am.
o'clock.
And Miss Valerie.
Yeah, I got an 11 o'clock. So
Okay.
all
Bye,
right.
Miss
I
Valerie.
do too.
It's 11
I
o'clock
have 11
now.
o'clock too.
So that's all our time for today. I love y'all. Y'all
Okay.
take good care, and I will see y'all tomorrow is Friday. So we got our stretch and tone class tomorrow. Be clean, be safe, keep those gloves on, and make sure you stay away from these folks coughing. Y'all be good now. Bye.
Bye-bye.